Welcome back to Good Morning Arkansas. Researchers at Stanford University say it's not that we're eating too many calories. The problem is we're just not exercising. That's their conclusion about why obesity is a growing problem in America. And today we have Dr. Bushra Shah with the Longevity Center at St. Vincent here in Little Rock joining us with the details on the study and her thoughts on that. Good morning. Good to see you.
Good morning. Thank you. Yes, this study was done in Stanford over about 20 years.
20-year study?
20-year study. And then the researchers concluded that there has been a sharp decline in the level of leisure physical activity amongst Americans, and that was seen more commonly in women. When they compared the study findings from current day to 1994, they found that nearly half the women in the study right now, or in the recent past, were not exercising versus a lot less back in 1994. There was a threefold increase in women not exercising. 40% of men reported that they were not exercising as compared to those that were not exercising in 1994. So there was a fourfold increase in men not exercising.
Now, what are the reasons they're giving for not exercising?
Well, I mean, you know, several reasons: working more than 40 hours, don't want to be away from their family, leaving children behind. They're tired because they've excessively worked, because they're overweight. They don't want to go to a gym and look overweight. They think that's unattractive. They can't afford to pay for a gym. So just weather, it's too cold, it's too hot, I can't exercise. Just, you know, several reasons that we just don't want to exercise.
And what's the impact of the lack of exercise on
well, I mean,
weight?
They found that there was a 0.37% increase in the average body mass index every year in this study, although they looked at the caloric intake, and the caloric intake was about the same, so the level of activity was less. And a woman is considered abdominally obese if her waist is greater than 34 inches and a man greater than 40 inches. And they found that there was a 4% increase in this waist size per year in men and women. So therefore, we are getting fatter and wider and from lack of exercise. And I just want to point out, body mass index means it's a measure we take with height and weight. The numbers that you need to know is less than 18 is you're undernourished, between 18 and 25 is where you want to be, and 25 to 29 you're overweight, and if you're greater than 30 you're obese. So when you go to your doctor, they, along with your vitals now, your blood pressure, your heart rate, we take your body mass index. We take your height, we take your weight, we apply it to a formula, we tell you what your number is, and that determines whether you're overweight, underweight, or obese. And if you are overweight and obese, we need to work on it because that reduces your lifespan.
You're talking about abdominal obesity. Why is that such a huge concern?
Because abdominal obesity increases your waist. That's your measure of your waist. And we divide you to apple-shaped people or pear-shaped people. And we found out that those people who were apple-shaped with wider waists, despite their body mass index, which is their height and weight, being the same as the pear-shaped people, had an higher risk of death as compared to the pear-shaped. So that's why it's important to, and a lot of diseases have been attributed to that, to Alzheimer's is, you know, now there's a direct relationship to your waist size, your waist circumference, to Alzheimer's and diabetes, and you know. So.
And it's always the toughest to lose too, because I mean, I work out 4 or 5 times a week, and I still got the, you know, the what do you call it? Love handles, I guess would be the easiest way to call it.
Well,
and it's the hardest to get rid of.
It is, and you know, I mean, although it's important to pay attention to your calories as well, but it's very important to exercise.
There are a lot of obstacles to overcome to exercise.
Well, I mean, you can make it a family activity. If you think that you're leaving your children behind, you can, you know, we use our work as an excuse. So we have to really, you know, give our health some priority as well, and not make our work an excuse. If it's cold outside, work inside. If it's hot outside, you know, you can find a gym. If you can't afford a gym, then you can find a place in your home. You can do planks and push-ups and sit-ups at home. You can walk in place. You can go for a walk. If money is an issue, you can find swimming and other things that are easily available to help you exercise.
Thank you so much for coming on to the show. The bottom line is, we just got to eat right. We got to exercise. Get in shape. Get America back in shape. All right. Thank you so much. That's Dr. Bushra Shah with the Longevity Center at St. Vincent. And you can contact them for more information. All right. It is going to get cold, but you can exercise inside.
Exercise inside.
That's right. We got some cold weather in the forecast. We'll have details on that in just a little bit. Stay with us.